Good evening, everybody. I'm Dr. Sita from OJS Aesthetic, your friendly doctor, and today I want to discuss something about cosmetic gynecology. You might be thinking, is this something crazy that's happening? What is cosmetic gynecology? Yes, cosmetic gynecology sounds to be something different from the gynecology that normally we do, but it's an extension of the gynecological services that we do, especially pertaining to the age groups where there are certain changes that happen in the genital organs. So, this is again a misnomer. Most of the treatments that we offer target the functional changes that happen in the body, and it is in the direction of changing or reversing these changes that help them to live better. Therefore, it is not completely functional. I should say completely cosmetic. I should say it is part cosmetic and part um functional. So most of them are requested by the client itself. Therefore, that is the misnomer there. It is called cosmetic gynecology. Now, as the cosmetic gynecology is gaining interest both in the client and the physicians all over the world, there are rapid changes in the treatments that we are offering. There's a lot of scientific knowledge that is added to the treatments that we are offering, and the benefits and the usefulness of the treatments has is an evidence-based science today, and therefore that is the reason why we can confidently say that these treatments work for the better of the client. So, what we do in this for these treatments in the functional gynecology part, usually people come with changes in the genitalia, and they experience certain kind of disturbances in and around their middle age, or sometimes in the early ages also. So most of these changes start after the childbirth or repeated childbirth, and the people come with certain symptoms. The most important symptom that people in the younger age groups or the middle age groups come up uh, is with urinary incontinence. It could be a temporary incontinence during the childbirth or just after the childbirth, or it could be an incontinence or a stress incontinence that happens during the menopausal age groups. As we all know, the pathology behind this is a lack of estrogen, and there is a muscle weakness. Therefore, the sphincter of the muscles is weak, and there is an irregular contractions also sometimes. So there can be either stress incontinence or mixed incontinence. Of late, previously, these were dealt with only surgical treatments where only certain modalities of treatments were done, and therefore not many clients used to opt for these treatments and still suffer in vain. So, but now we have treatments that are very easy, that are safe, and can be done in the outpatient as an outpatient procedure. Therefore, they are very safe and they are opted by a large number of clients. So, what are the treatments for uh, incontinence, or we should say stress incontinence at this point of time? Stress incontinence can be dealt with either the laser treatment, that is gynecological lasers like diode laser or the CO2 laser or the FBM YAG laser can be used to control the sphincter thickness. I mean, actually it is the neocollagenization in the floor, that is the anterior vaginal wall in the floor of the urethra. Therefore, there is a thickening around the urethra, and there is a good collagen, and there is a fiber in the collagen fiber building which gives strength to the sphincter, and people experience a decrease in the incontinence. Other treatments include the mechanism of the again neocollagenization is same in other treatments too, but they differ in the way that is administered. Therefore, PRP actually works when we inject the same plasma, platelet-rich plasma into the anterior fourchette area and around the skin glands. This will help to increase the thickness and build the muscle around the tissue. And PRP, as you all know, is a molecule is having a lot of peptides molecules, which will increase the cell growth and also increase the collagenization in that area. And therefore, it's helpful in reducing the incontinence. There are other functional changes that happen, that is lack of libido, sexual dysfunction, and lack of interest in the sex due to the dryness and due to the friction that dryness causes. And the introitus is very thin because of the estrogen lack, and most of the people lose interest. Most of them do not seem to convey that message, but once they open up and ask for this. And when this laser or rejuvenation is done with the help of a CO2 laser or the diode laser, it is phenomenal for the client. And it improves their sexual function. There is increase in the secretion and there is a balance in the life. So most of the functions, most of the treatments that the cosmetic gynecology concentrates is to improve the lifestyle of the client and to improve the function of the genitalia or the region. So this is very, very helpful and it is very, very rewarding both to the client and the physician. The other very, very unfortunate thing that many people suffer silently is the vaginismus. Most of the time, the marriages may not be consummated, and there could be a lot of pain. There is a contraction of the muscles around the pelvis. This is actually the original vaginismus, the functional vaginismus. This cannot be treated just by doing some therapy or treatment. Initially, the client has to be taken into confidence, and sometimes the examination under anesthesia is necessary to ascertain that it is a vaginismus. And such patients do benefit from treatment with Botox injections. Once the Botox injections are done, the vaginismus is decreasing, and once the vagina has a penetration and consummation, sexual life becomes better, and the vaginismus is solved forever. The other vaginismus that happens is sometimes due to trauma or some mutilation and due to some hesitancy. This is sometimes secondary vaginismus, also due to infections. And here also we resort to best counseling, first of all, taking the client into confidence and slowly improving her vaginal structures with the help of either the Botox. Here, vaginal therapies like radio frequency also work, and the certain relaxation exercises have to be taught. Some meditation programs have to be started so that the mind and the body are in sync with the vaginal function. This causes an overall change in and a positive attitude in the client, and therefore cosmetic gynecology is a misnomer, but it helps to improve the function of the genitalia, the vaginal area, and the psychosexual changes that happen further after the treatment are very, very helpful and positive in their lives. The other important gynecological treatments that are requested is laser hair removal of the in the area of the mons pubis or the bikini area that is called, and this can be done with lasers alone, and this is also very safe and very effective. Uh, Sometimes the intimate area can be, these are requests that come from mainly, I should not call it functional treatment, but part functional and part cosmetic, because the intimate area darkening and the pigmentations can be removed either with the glycolic acid peels or with lasers, which can be used intermittently or consequentially, and there can be a change in both the intimate area and therefore the confidence building of the client. The other lasers that can be used are the diode laser, which can be used for total vaginal rejuvenation. The other most important complaint that most people, and now it is the vaginal or the warts that can be removed with the diode lasers or the CO2 lasers. And this is a one-time cure for a large number of warts. Of course, human papilloma virus is the reason for these is the reason for these warts, and a papilloma virus vaccination can help to decrease the load of the viral warts and also will help in the further decreasing the carcinomas. The reason for people coming around for the chronic vaginitis is increasing a lot. We thought previously that it is a fungal infection or a mixed bacterial infection, and the client goes around from physician to physician, gynecologist to gynecologist for the treatment, and they are loaded with a lot of antibiotics, antifungals, and many other treatments, vouchers, and so on, so on, but there is no improvement in the vaginitis. Such cases can be very nicely treated with a vaginal rejuvenation with carbon dioxide laser or a diode laser, and within a one sitting or two sittings, there is a lot of improvement. This is because there is a sloughing and there's a removal of the upper layers of the vaginal epithelium. There's a rejuvenation of the vaginal epithelium subsequent to this technique, and there's a new epithelium and the irritation comes down, there's an increase in the secretions of the vagina. Therefore, it keeps it moist and very, very healthy. So this is very important to understand that cosmetic gynecology can play a major role in the function and disability of the genitalia to improve the area and to also improve their lifestyle. Therefore, cosmetic gynecology, once again I say, is an essential part of a woman's life, both in their early 20s, in the middle age, or in the older age. So, in the cosmetic treatment, sometimes women come to us and they ask for certain changes which they do not like as they are aging. Mostly the labia. The labia get very thinned out, and there may be a sagging of the skin of the labia. And usually we opt for a labiaplasty in this situation. But nowadays we are also opting for a non-surgical method of labiaplasty, that is with the RF technology, where we can do an radio frequency on the labial skin, and the skin can improve. There could be a little turgid skin, and the sagging of the skin can be reduced. Of course, this has to be done in serial settings, and then you get the very good changes in the skin. Apart from this, we can opt for either filling of the labia majora with the fillers, which is a very easy change, and the hyaluronic acid, which is cross-linked, can be used to fill the labia, and this becomes an immediate change, and there is a fuller labia like the youth. Apart from this, people ask for, as I told you, laser hair removal both on the labia and the mons pubis, and this is called the bikini laser. This is very helpful in reducing the amount of hair that is there and the chronic irritations that can happen at this area. This is also opted by young women because of the increase in the skin irritations that they have. There could be a lot of pimple-like pus-filled eruptions that happen very often around the periods, or even in the menopause. This kind of an eruptions in the acne, which do not occur according to the cycle changes or the hormonal influences, is also called an hidradenitis suppurativa, because these have certain other influences with the sweat glands, interconnections with the sweat glands, and there is a foul swelling discharge from the acne-like eruptions. One of the reasons for eliminating this condition one of the treatments for eliminating this kind of condition is laser hair removal, epilation, and also removal of the acne scars that is there on the mons pubis and around the labia. So these two treatments help to get back into shape, and the confidence of the client is very, very good. Apart from this, the intimate area rejuvenation can be done with certain peels which moisturize the tissue and also remove the pigment with a little aftercare. There are glycolic acid peels that can help to improve the intimate area, and these can be done serially and in few weeks durations, and you get very good results in 3 to 4 sessions. Therefore, cosmetic gynecology can be used both for the functional improvement of the tissue and the cosmetic improvement of tissue. Both of them target to improve the lifestyle and the confidence of the client.